Good morning, everyone. Again, I'm Kelly Caseman, the Executive Director of Think Kids, and I am happy to welcome you to Session 3 of the Health and Hunger Summit series. This is a virtual series where we will take a candid look at connections between the healthcare system and community resources that address hunger in West Virginia. Health and hunger are profoundly connected. Their systems should be too. You can find more information on our website, thinkkidswv.org, and on our Think Kids Facebook page. And we hope you'll join the discussion because more than ever in this moment, we need to unite in our efforts to ensure that all West Virginians are as healthy as they can be with access to healthcare and nutritious food. There are a lot of challenges to addressing this, so we're glad you're here with us. Now, we know that a lot of West Virginians are on the internet right now, and so if you get disconnected or have difficulties hearing, please know that this is being recorded and will be shared on our social media site this afternoon. Also, you'll have the opportunity to share your thoughts and ask questions at the end of the panel discussion. Go ahead and type them in the Q&A or chat box while they're fresh in your mind if you'd like, and we'll get to them at the end of the presenters panel. With that, we'll get underway by thanking our sponsor for the event of this series, Unicare Health Plan of West Virginia, and introducing Tad Haynes, President of Unicare.
Hey, thanks a lot, Kelly, and good morning, everybody. On behalf of Unicare Health Plan of West Virginia, I'd like to welcome you to the Health and Hunger Summit Series, the first summit of its kind in our state to build bridges between the healthcare delivery system and community food resources. We know that health and hunger are connected, and for this reason, so should the systems that provide care. We'd like to express our gratitude to the panelists and attendees for joining us today for Session 3, Health and Hunger from the Community Resource Provider's Perspective. We'll hear from 3 resource providers from around the state who will share their personal experiences in addressing hunger in their own pantries and in their own respective communities. We hope this is an interactive session. Your input and insight are valuable to creating a larger discussion in our state to address these disconnects, which in the midst of the COVID-19 pandemic is a critical conversation to have. And so thanks again for joining us. Unicare Health Plan is a Medicaid managed care organization that has been serving West Virginia since 2003 and is part of the Anthem family. Through our work with vulnerable populations throughout the country, we know that there is a strong linkage between health and access to social and economic opportunities. The conditions in which we lived oftentimes explains in part why some of us are healthier than others. Living in poverty, living in a food desert, or living in a situation where there is a question of where our next meal will come from are all factors that can cause poor health outcomes that have to be addressed by the healthcare system. For these reasons, we are proud to sponsor the summit and partner with the Think Kids organization led by Kelly. Kelly, thank you for your leadership.
Thank you very much, Tad. And with that, let's get underway by introducing our first presenter, who is Vandalyn Justice. She is with the Salvation Army in Charleston, West Virginia. A licensed social worker who graduated from West Virginia State University Social Work Program. She started in the field of social work at the United Way's Information Referral Program. Following the United Way, she now works with the Salvation Army, running their social service program where she oversees the food pantry, financial assistance program, the Christmas Angel Tree program, and currently providing community outreach with food box distributions and hot meals out of their disaster canteen. She is an active member of the West Virginia Jeep Club and loves camping, hunting, and traveling with her daughter and fiance. Thank you for joining us today, Vandy.
Oh, you caught me off guard. I didn't realize I was first. I'm waiting for my presentation to come to me as I just finished working on it. I guess just start going down with the questions. Hold on one moment. I'm so sorry. What hunger looks like at Salvation Army. Hunger takes many forms. Could be a family with children. A lot of families are now experiencing additional nieces, nephews, grandparents with grandchildren. A lot of these folks don't get the additional SNAP benefits that they need to supplement for their additional family members. Senior citizens are a rising population of individuals seeking food assistance. I have 71 active seniors receiving a monthly food box and 13 on the wait list right now. The average senior only gets about $16 a month in food stamps, so that doesn't get you very bar at the grocery store. Our homeless population ever increasing. We see anywhere from 2 to 5 homeless individuals a day. Their needs are very different when handing out food for them. So sometimes it's a challenge finding the right foods that they can pack along and take places, or just fix without, stove and keep dry and clean. Households with children are the ones who get the least supplemental support, and that's probably the largest group of folks that we serve. Probably around 250 plus individuals between 18 and 59 a month come in searching for assistance with food. Many of these households live off small Social Security checks, have no income, or have been laid off. Cut hours is a popular thing we're seeing right now. Low wage jobs, and most of them don't get many SNAP benefits or only get them for a certain period of time. To assist a household, we require basic info such as household members, names and birth dates, address and phone number if applicable. Income sources, we do ask if they have insurance. Sometimes they choose not to answer, and sometimes they do. And their housing status, whether they're homeless, whether they rent with some kind of assistance, or own a home. We're required by the USDA Commodities Program to collect some of this data, and we also use the data to show funders, to show our divisional headquarters what we're doing, and we use it as a monthly stat so we know how to best serve our folks and who we're serving. Health issues among clients. Many of our clients present health issues. Some discuss in length, some don't discuss at all. Lot struggle to pay prescriptions, copay costs, struggle with transportation to and from doctor's offices, or don't have any insurance at all. Salvation Army tries to help with prescriptions and partners with Fruth Pharmacy often. We sometimes try to purchase medical supplies within a reasonable dollar amount. We have the advantage of using our thrift store, so we can provide donated items like walkers, wheelchairs, potty chairs, or other donated supplies like a medical bed or something of that nature. We have places like Humana and other supplemental insurances set up in our lobbies to enroll eligible clients. During the winter months, shelters, we partner with Cabin Creek Health Centers to provide basic medical needs and referrals to our homeless population. And we're currently talking with Aetna to provide a flu shot clinic within the next month or so. We get referrals from hospitals for folks needing car seats, clothing, food, prescription assistance, and other needs before they can be discharged, or if they have a family member staying for long periods of time. We provide referrals to HealthRight, Cabin Creek Health Centers, Family Care, WIC, and other agencies we think that could benefit our clients. Before COVID, kind of touching on that little question, we provided typically 150 households a month, non-duplicated within the month. Busiest times were the end of the month and the beginning of the month. Post-COVID, March and April almost tripled the amount of households needing food pantry assistance. Once the government stepped in and provided that additional SNAP benefit or that $300 help that they gave a lot of families with children, it slowed down for a while. But now within the past month, I'm seeing a rather large pickup in requests once again. We kind of changed our process and how we're helping people. We encourage them to call ahead of time to make an appointment for the food, so we're not having large amounts of people walking in our area, congregating. Only one client in the lobby at a time, and of course they must wear a face mask to enter the building. We're trying to do the applications over the phone, so they're not standing here and waiting for long periods of time. And we are trying our best to deliver food to our folks that are 60 and older, so we can protect those most vulnerable. Some of the biggest changes that we've done after COVID, for how long this will continue, I'm not sure, but right now it looks like it's going on for the next number of months. We've been providing hot meals out of our canteen twice a month to the east side of Charleston and the west side. Every time we go out, we serve about 300 plus meals each time. And we're reaching out to some of the Other areas that just have a little bit more food insecurity, such as Mahan and Logan, Chapmanville, Clendenin, Dawes, West Virginia, and we're taking pre-packed food boxes and handing them out with the help of United Way and Cabin Creek Health Systems. So we're kind of taking the food to them versus them coming to us, which has been a challenge, but we average anywhere from 150 to 250 families each time. Trying to think of other questions that I was trying to touch on. Since the pandemic began, we have had some struggles keeping food in our pantry, just for the sheer amount of folks coming in at first. Stores weren't letting us place bulk orders because they couldn't keep food on the shelves, so that presented a little bit of a challenge. The only places we didn't find a challenge were we get donations from Kroger's, Sam's, and Chick-fil-A and Outback. So things like meat, dairy products, produce, and bakery, we always have a plethora of. But those things like mac and cheese and rice and stuff that were flying off the shelves, you know, when people were panic shopping, they became kind of hard for us to grab a hold of as well. I'm trying to think if there's anything else that I missed on. Of course, the holidays coming up. We always give out a gift card to all the folks that sign up through our Christmas program for food or to help purchase food. And we help 200 seniors each year with our Christmas program with a gift card for food. So I don't see those numbers changing this year. Possibly more folks signing up for Christmas, but I don't know. We'll see how that goes. We're just starting that process right now. I'm not sure. Is there anything I missed on, or anybody have any questions? This is the first time I've ever presented, so.
You were wonderful.
Thanks.
And you are an incredibly busy woman, so we
Yes.
thank you for your time. And I'm sure that we'll have some questions at the end of the panel. So folks, feel free to write them in the chat. So thank you, Vandy. And we will move on to our next panelist, who is Sarah Lindsey. She has served on the as Chief Program Officer of Catholic Charities in West Virginia for the past 2 years. She has a healthcare background as a board certified and state licensed master's level occupational therapist. She worked in community-based mental health and social service settings for the past 17 years. She is experienced in providing client-centered services with a wide range of populations, including those affected by homelessness, substance use disorders, chronic mental illness, people who are incarcerated, at-risk youth, and families affected by poverty. Her medical experience is primarily in home health care and skilled nursing and rehabilitation facilities, working with aging populations and people with disabilities. Sarah's university teaching experience includes courses such as Community and World Health and Interventions in Mental Health Practice. Growing up in southwestern Pennsylvania, Sarah's passionate about working towards improving community health in West Virginia. So welcome, Sarah.
Thank you, Kelly. Hi there, everyone. Thank you for being here today to hear more about food insecurity in the state of West Virginia. And many thanks to Kelly and Think Kids West Virginia for inviting me to speak to you today for a little bit and to share a little bit about our agency level experience with food insecurity in the state. So to get started, I just thought it would be helpful to give just a brief background about what we do at Catholic Charities West Virginia. So we are the largest private social service agency in the state. Our services address needs across the lifespan. We have 11 different program types, and we have multiple sites where we serve throughout the state. We don't necessarily have an office in every single of the 55 counties, but we do try to provide a safety net in all 55 counties where they can call any one of our offices if they need additional information or service. I want to just briefly run down the list of the programs that we offer so that you have a good idea about the scope of what we do. So I said our programs span the lifespan. So one of our programs is the Birth to 3 program. So in Birth to 3, we provide early intervention screening, in connection to services for developmental delays. We have a child and adult care food program. That program provides nutritional support for child care agencies, including child care at home settings. We have a child care resource center. That's the program that processes application for child care subsidies and provides education to child care providers. We have a basic needs program vein. That's the one we're going to focus on mostly today. Case management provides long-term in-depth support to people in meeting their goals. We have a couple different sites that serve adult education, and those sites are for folks that are looking for their high school equivalency diplomas or for additional vocational certification programs. We have a migration and refugee services program in a couple different areas of the state. We have a disaster services program, helps in times of disaster, and then during what we call blue sky times, they just serve as helping agencies and folks to get prepared for disasters that may strike. We have a SNAP outreach program, and we have a home care program. So the home care program primarily serves folks on disability through Medicaid waiver and Veterans Waiver Program. So anytime I talk about sort of what we do, you can have sort of a reference point as to everything that we provide. So what does hunger look like in West Virginia? Well, hunger, that's kind of a funny question because it often doesn't look like anything in particular. So hunger is often invisible. People come to us for food assistance through three primary ways. The first is word of mouth or walk-in services. Secondly, we have a lot of good, strong partnerships with other agencies in our communities, including the United Way 211. So Margaret O'Neill spoke a couple weeks ago about United Way and specifically the 211 services where people can call in if they need help with really anything. And those hotline folks are able to connect people with service. And then the third way is that food insecurity can be uncovered through any of those program veins that I talked about a minute ago. So if someone comes to us because they need childcare subsidy assistance, and through that initial intake process, we realize that hunger is a problem in the household, we can get them connected with food and one of our food pantry programs, and often SNAP benefits too if they don't have that. And then just lastly, an accurate assessment of food insecurity involves several key things. So it's not always, it's more complicated than it seems like it would be. So these are some of the ways that I think in our agency we do a good job of providing client-centered assessment for food insecurity. The first thing on the list there is trusted rapport. And I realize trusted rapport only happens after you've been with someone or a family for any length of time. So during your initial intake, that doesn't really apply, but it is important over time to keep that in mind. Non-judgment always, of course. Client-centered services and staff approach. So for us, we really do a lot of work to try to help our staff to understand that the client and the families we serve are in the driver's seat. They're the ones that are experiencing whatever barriers or challenges they have. So it's important that we rely on them to tell us what they need and how they feel. The intake interview, so we do have a standard intake process, an interview that we do with folks whenever they come in for food in our pantries. When you're designing a sort of an intake interview, it's important to sort of weigh the length of that interview. You want to gather everything that you need, but you don't want it to be overly lengthy to turn people off. Consideration of social determinants of health is important when you're assessing for food insecurity. We'll talk about that in a couple slides here. Mindfulness of cultural consideration. So there's a lot of sort of commonalities that appear when working with people from different cultural backgrounds. And by cultural, I mean even like Appalachian culture is a whole thing. You can read, there's tons of good books out there on describing what do people in West Virginia experience. And like Kelly said, I'm from southwestern PA, but I consider myself kind of close enough. I lived in a very rural area growing up, so I do understand too some of those things. Things like, pride is so important and so key for people in West Virginia. Being able to take care of yourself. If you live in a very remote area with little social supports, you're used to sort of fending for yourself. So that kind of creates a different personality in folks. it's good. In a lot of ways it's good, but it's just something to be mindful of. And then lastly, just acknowledging and validating that there are true environmental challenges and barriers to living in West Virginia, living in a very rural state. There are just things that make it difficult. Transportation's difficult, living where you don't have a lot of social supports, living where maybe there aren't a lot of resources around you immediately to take advantage of for help and for services. Those are all real challenges. So what do we know statistically? We at Catholic Charities West Virginia, we've been making a point to, whenever we talk about the folks that we serve, really sort of drive home for people that don't understand or who have never been exposed to public health statistics in West Virginia. Public health, and we learned a little bit about this when we had the physicians on last week in the summit, which I thought their talk was excellent. But just to reiterate some of the things that they talked about, public health stats paint a picture of an extremely high need in West Virginia. So these are some of our stats for the state. So we are first in the US for prevalence of cardiovascular diseases, first for COPD and lung problems, respiratory disease, first for arthritis, second for prevalence of diabetes, and then third for prevalence of all types of cancer. And then a couple other things to just sort of keep in mind that also fall under that social determinants of health. You know, what do we experience in our daily lives that contribute to whether we're healthy or not healthy? Some of the other things in West Virginia are substance use disorder, which I know we all know is a huge concern in the state, has been for years, but something that a lot of agencies are still very actively working on. So substance use disorder and drug overdoses are higher in West Virginia than the national average. This second one sort of floored me. I was at a public health conference and I learned about this, but the suicide death rate for older West Virginians, and it's like 65 to 85-year-old age range, is double that of the United States statistic for that age range. Just so troubling when you think about it. So that's one. Poverty rate, of course. Obesity rate, I think we're number one for obesity rate. Tobacco use rate is high. We have a lower rate in West Virginia of high school and college degree completion. The lowest employment to population ratio. So that number, it doesn't necessarily mean that we have the lowest unemployment or the highest unemployment. It means that for all the West Virginians in the state, for their skills and their experience, they don't match up with what the needs are locally in the workforce. So if people are coming to you and saying, hey, I just cannot find work, and you know, it's probably true that they just cannot find work. It's really hard because a lot of the folks that we serve, their skills and their experience don't match what the workforce is needing, or there's just not the workforce to warrant. You know, there's not enough of those jobs for everyone to be employed. Lower life expectancy. I mean, that's the bottom line. At the end of the day, all those things we talked about, just like I said, paint a picture of just a very high need population in terms of health. So what does this mean in practice? So for us and our social service agency, Catholic Charities West Virginia, we really try hard to focus on, I said we provide client-centered service. So we focus on not just one area, not just the hunger, but the 8 dimensions of wellness. So people may have barriers or struggles or challenges. The whole family or any one person in the family could have, you know, several challenges in all of those little bubble areas. So it's important to us that we train our staff and that we equip them with the tools they need and the knowledge they need of resources to connect with addressing issues in any of those 8 areas. A lot of times we're able to kind of fulfill those needs and provide support internally because we do have such a wide range of services, but not always. So there are some times when we do need to refer out and get people the help that they need to be able to alleviate the hunger. You know, sometimes the hunger is what we see on the outside. What's what we see when they come to us as a need, but there's so many underlying things that have happened in the life of that family prior to the time when we meet them, that those are things that really need to be addressed for a lasting change. So for COVID-19, what we've seen, I would just echo everything that Vandy said. Of course, we see and we've experienced those same things. It was kind of interesting in the beginning, the first couple months of COVID, we actually saw a decrease, a dip in how many people were coming to see us. And I think that that coincided, what we attribute it to anyway, is with the stimulus checks that came out. I think that that was helpful in getting people sort of over those couple months and over that hump initially. I also think West Virginians were doing a pretty good job of following national advice. You know, it is scary, and we have a lot of older folks. We have a lot of people who are already vulnerable. So if they're doing what, you know, the government and local officials were telling them to do, they were trying their best to stay in. Now, since those first initial months, we have seen an uptick. So we've seen more and more people in need now. We also see a lot of people who come to us for financial assistance for things like rental assistance at this point, and for utility assistance. So utility assistance was put on, the assistance wasn't put on hold, but the utility companies were not sending out shut-off notices. Like, they were holding off on that the first few months of COVID, but then there was a point when they started just sending out those bills. And they're still working with us. They're working with social service agencies, but it's hard on the clients. It's hard on the families. So we do our best to try to, plug those holes too for folks, along with providing the food support. These are just a couple pictures of us, the ways that we've had to adapt in our food services with COVID. So we have 13 different food pantry locations across the state. 5 of them are mobile food pantries. So that's where we drive a big van into the county and meet in a parking lot with the same 50 families each month, to give them their food. But then the others are the traditional food pantries, where we have people come in, and typically we again highlight a client choice. So we like to sort of set our pantries up ideally as sort of a little grocery store where people have choices, and they can come in with their kiddos, and if the kids like Cheerios over Fruit Loops, they can have those sorts of choices. Now, we had to change all of that with COVID. So with COVID, we adapted a drive-through style where we went back to sort of the old way of putting a bunch of food in the boxes and then just handing off through the car window. So that's where you see my boss and I, our CEO, Beth Zarati, there beside me. We were packing food boxes that day for the drive-through. Another service that we provide in Wheeling in our office is we do deliver hot meals. So to about 200 individuals in that Wheeling community, 6 days a week, we provide hot meals. So that continued. We just did our best with prepackaging things and stocking up our volunteers for that program with all the PPE that they needed, the masks, the sanitizers, and we changed our process a little bit where we usually like to open the door, say hi to the senior. It's usually a senior or a person with a disability who's receiving our delivered meals, check in on them, but we instructed them very clearly to, even though it seems not friendly, don't open your door to us. We'll knock and we'll announce ourselves, but we'll leave your food at the door and then just pick it up once we leave. Those are just a couple examples of things we've done. So lastly, I just wanted to finish up with healthcare partnerships. We are super excited about talking with any healthcare provider out there, any agency, nonprofit that is focused on health and wellness in West Virginia, to talk about ways that we can partner. So to answer one of Kelly's questions that she asked us to prepare in preparing for the summit today, she said, what are your general thoughts on how we solve these problems? Well, in our agency, partnership. If I had to answer in just one word, it would be partnership. It's so important that we all do what we do to the best of our ability, and then rather than recreating wheels or becoming inefficient, we work together to solve the biggest community needs. So Project Hope partnership. Project Hope is a medical street outreach for folks that are homeless, people that are sleeping outside, people that are chronically mentally ill a lot of times. And it's a group of doctors and nurses from Wheeling Hospital. So they provide street outreach medical support to folks in the Wheeling area. They're a fantastic program. They come into our site in our food pantry location in Wheeling and provide care 1 day a week. The adult education partnerships in the recovery community. So we do focus, both of our adult education programs in the state partner with recovery programs. So people that are in a specialized housing program after recovering or initially recovering from substance use disorders. Those are the folks that we work with for adult education. And then we have a newly grant funded through Catholic Charities USA, a Wheeling Hospital Transition Program. So that program we're real excited about. We were just awarded that money to work with Wheeling Hospital as to create kind of a bridge for people whenever they're discharged with barriers. Maybe they don't have enough food at home, or they have a specialized diet because of a chronic disease, be it like diabetes. They need low sugar foods, or heart disease. They're looking for low sodium foods. We're going to have a food pantry that is designed as a food pharmacy program inside the hospital, Wheeling Hospital, that our staff run, so that people being discharged home can learn a little bit more about managing their chronic ailments and diseases before they're discharged. And then our staff will follow up with a home visit and follow that person for 60 days so that we know that they have their medications, that they've been able to get transportation for their follow up with their primary care doctor, and those sorts of things. So that is pretty much what I wanted to talk about in a nutshell. Thanks, Kelly.
Oh, thanks for this presentation and all that information and
Sure.
all the. I'm going to follow up on that Wheeling Hospital Transition Program. That sounds really exciting. So our final panelist today is Work Sizemore with Pantry Plus More in Morgantown. After seeing an increase in young kids coming to homeless dinners, high school senior Work Sizemore found a way to bring much needed resources directly to children so they wouldn't need transportation or money. He started the Pantry Plus More, putting pantries inside of schools. Now, 3.5 years later, he has adapted the program because of COVID-19 to provide emergency food boxes, fresh produce, and more. Work is the president of the board of directors and a native of Monongalia County. He believes that education is the key to fighting our way out of poverty, and we must do everything to help children have all the resources they need to focus on learning. Thank you so much for joining us today, Work.
Thank you so much for having me, and thanks to everyone who decided to join us today. So first off, like she said, I'm with a group called Pantry Plus More in Morgantown. And what's a little bit different than us than the first two organizations is that we're not part of a larger national organization or national brand. We're still a 501c3, but we're a little bit newer. So we're kind of in a transitionary stage to getting into more stable practice, like some of the groups like Catholic Charities and the Salvation Army. So primarily what our program does when we're not in COVID, when we're not in a pandemic, is it takes the idea of a food pantry and it puts it inside public schools. So rather than just food, though, we think kids need some other stuff too. So it covers food, clothing, school supplies, and personal hygiene products. And the way it works is that kids can come anytime they want, as often as they want, and take as much as they want. I'm not too far removed from being a kid, and I know kids can be mean about when you need something, when you need a little bit of help. And so we want there to be a way that kids can get the resources that they may need without necessarily having to ask in front of somebody, and without necessarily having to deal with all the stuff that goes along with getting help. And people having eyes on that. So that's kind of the program, the main program when we're in school and kids are all there. But now, because of COVID, programs like that can't really be in the schools. So we've had to really adapt to meet the need. So at the beginning of this summer, we started a delivery program of emergency food boxes that essentially had staples. And then we were trying to make sure that there was a gallon of milk, a frozen meat item, and produce along with that. And then by the second week, we were doing a loaf of bread too. So it was quite a bit of stuff, which was a little bit of a change from the way the pantry works, where that's kind of a everyday thing where you're just getting the couple things you need. We had to move towards that more bulk kind of sets of food, right? That some of the others mentioned. And so we were doing about 1,000 people deliveries, right? So it was this huge undertaking, about 40 delivery drivers, pretty long routes for folks. It was pretty unsustainable, but we did about 2.5 months of it, a really big program. And then when we got back into school, we've kind of transitioned into drive and go, like pickup locations. So we have 4 different ones where folks come by and pick up. And so we try to do everything contactless. And it's the same setup of a Staples box, some frozen meat, a bread item, as much produce as we can get out there, and then a gallon of milk. So those are the programs that are kind of the way we've adapted to meet COVID. With our need, we've actually seen a pretty big increase. So the pantry programs, we're in 11 of the 17 or 18 Mon County public schools. And so we're seeing about 1,100 students regularly when we're outside of COVID. But now we've been serving about 1,300 families through different programs, mostly through deliveries and pickups. And we've been really lucky. The way we identify these families is through a group called the Outreach Coordinators that each school in Mon County has, right? So essentially what it is the school hires a social worker. And so that social worker is kind of connecting us between students that are in need. And so to kind of get around some of the privacy concerns and things like that, essentially they give them a sign up with us, and then we can do delivery, that kind of stuff to them. The only kind of information we're taking in for that are essentially names, some basic information about like the school that they go to for our kind of record keeping. And then an address, email, phone number, some way to contact them. We're not very interested in income or anything like that to decide whether folks need help. One thing I think that COVID has helped people see that I think is a really important idea within kind of this work is that a lot of times we think that people just need like what they need right then, right? The very basics, what they need to survive that week, right? And I think that's a really bad way to think about food assistance, right? Because if you go home and you look in your fridge, right, you don't just have the food for today, right? And you don't know exactly how you're going to use all that food, right? And so how do we expect people that are in poverty, right, that need help to week to week to week to week, just get the bare necessities, right, to just get enough to survive? That's one mistake. That's one accident. That's one problem. That's one unforeseen circumstance away from being hungry, from having a real problem. So I think if we change the way we think about this, that it's not a bad thing when people take advantage of the system, when they store up, when they stock up a little bit, right? You know what, if that's kind of a clear idea that that's how you get out of poverty, right? Is these folks have to save. They have to take advantage of these resources. They have to make it to a couple different pantries. And that's a tough thing to ask of people. And it's even tougher when we stigmatize folks trying to get ahead. And so I think that's something that we've really had to learn, is that a lot of the folks maybe that we're seeing now aren't necessarily what stereotypically fits in your mind is somebody who would need food assistance, right? And I think sometimes we get caught up in what that's supposed to look like, rather than just that people need help and you don't necessarily know their story or how they got there. But this food assistance or whatever assistance is being given can really help folks. So that's just one thing I really wanted to mention. But with our increased numbers from COVID, we've really had to look at some new avenues to kind of get food. So we're doing some of the retail donations, I think like Vandy said. So we have Panera, Sheetz, Kroger, and Sam's. The Sam's one is really great because it's been bulk frozen meat, which has been something that normally we have a little bit of a hard time getting for clients, and it's a little bit more expensive. One of the other things I would say about the kind of COVID experience is that another thing folks have wanted a lot, and it's not really food assistance, but masks has been a thing that we've been getting tons of asks for. And so we've had groups of people kind of sewing them and trying to buy them and put them together. But our clients are worried about COVID too, right? So when things aren't set up in a way that are COVID safe, like that keeps people away from the food assistance they need. And when people feel like they don't have, the right protective gear to come out to something, that also may keep them away. And we don't ever want that to be a barrier from somebody getting the resources they need. During this time, we haven't really had trouble staying afloat necessarily. I think the community in Morgantown and Mon County is really great for supporting things like this, especially kids and families. And so we've had resounding support for that. But I would say meeting the need is something that I think really no food agency can totally meet the need. To me, the need is like meeting it would be that somebody isn't going to need food assistance again, right? And I think that's a really tough thing to do with just food assistance, right? To me, food assistance is a Band-Aid for a problem that really needs a surgery. And that surgery is the larger problem of poverty, right? How do we pull people out of poverty? Because if people aren't in poverty, they have more money to spend on food, they have more money to spend on healthcare. And I'm a believer in something called Maslow's hierarchy of needs. And what that is it's essentially a pyramid. And at the very bottom of that pyramid are your basic needs, things like shelter, food, water, stuff like that. And before you can move up the pyramid to things that are more complex than that, right? Kind of taking care of yourself, self-improvement, things like that. You have to have your basic needs met. And so unless we can make sure that people are fed, unless we can make sure that they have shelter, we can't really expect that outcomes are really gonna change for folks in those situations. And then the ways that we've tried to hook up with healthcare providers and health organizations is that we have an ongoing partnership with Mon Health, the Mon Health Network in Mon County. So we've done a couple different things with them. It first started with they were just paying for our produce. So we were having a really hard time getting produce into the schools. And so about 2 years ago, they started sponsoring a produce program through the Mountaineer Food Bank in conjunction with us. And it went really well. It was great. Then we morphed it into kind of a food box program that had specific, essentially the clients were going to the doctor and the doctors were referring them with a special coupon for like a specific food box. That program was a little tough because a lot of the clinics we were trying to use around town don't have a ton of space to like really keep food boxes. And since everything's so spread out in West Virginia, it was really hard to ask a client to, get that coupon out at their local provider and then come all the way into town to pick up a food box. And some people didn't have transportation. So there were some tough pieces with that that really stopped us from continuing the program on past a year. But that's something we'd like to kind of try again. We have some different ideas with that. They are also a big supporter of our back to school bash. So when we're not in COVID, normally there'd be vision and hearing exams. There's like a big dental bus comes and they do like free dental screenings, stuff like that. So they're a big supporter of that. This year they funded our like hygiene products just because it was the drive-through instead of having kind of the hands-on services. That's essentially the way we've connected with them. I think it's something we'd like to do a lot more. It's just tough kind of figuring out some of the logistics of it, especially during this time when healthcare providers are so busy with other things. They've got their hands full. So, sorry there. I was getting a phone call that whacked my thing out of order. But yeah, so essentially our work with health providers has been kind of limited and more in a supportive way than kind of a partnership. So that's something we'd like to do better with. And then one of the final things I'll talk about is I think this idea, and it's ran through all three of our presentations, is that pantries right now are having to decide whether you just kind of limit the amount of work you're doing or whether you bring resources to the people who need them. So during this pandemic, that's really what I've seen as the biggest hurdle, is how do we find people in safe ways now? How do we get things to people in safe ways? And so I think that delivery piece is something that's been really popular, but I really don't think you understand how much it is, how tough it is to get done. until you start doing it. I think everyone who's running a delivery program can really say that it's a lot of work, and it's tough to find delivery drivers every time. And sometimes people get lost or they damage their cars while they're out on a route, and that adds a whole new element of kind of chaos into what you're doing. So it's a tough undertaking, but I think it's one of the best things you can do right now is try to find people where they're at. And I think that's essentially all I have. Thank you.
Thank you, Rourke. We really appreciate that. Thanks to all our presenters. So before we open the floor for attendees to ask their questions and share their comments, we have prepared some questions we'd like to ask the panelists. If you have a comment or further question regarding these questions, please feel free to write them in the Q&A or chat box, and we'll get to them as soon as we're finished asking them. So, question one. Tell us a little bit about any paperwork or information folks with you before you can ask to access services, pardon me. Like any income information or residency. So why do you collect this? Is it required for some kind of funding that you receive? Do you think it inhibits people from utilizing your services? Or is it a way to ensure folks in your community are the ones being served by your services? So I open that to all three panelists.
I think it's a little bit of all the above. If we don't report numbers and people can't see what we're doing, we're less likely to get funds and donations that help us to keep doing what we're doing. Some programs have income guidelines, such as the government commodity programs. So collecting that, now we don't have to do an in-depth detail, you have to bring physical proof for us because Salvation Army in itself doesn't give bias on income. But if I'm using a program within our Salvation Army or like government commodities or Dollar Energy for utility assistance, I do have to follow their income guidelines. So it is important to know those. And I think statistically as a whole, it's important to see, the different levels of incomes and folks and age groups and all the above to really see who's in most need and get a little, capture all that in the community. It gives a good understanding where we need to target our assistance the most.
Thank you, Andy. Rourke or Sarah, do you have anything to add before we move to the next question? Okay.
I think she pretty much covered it.
Yeah. Thanks, Rourke. Okay, next question. There's been a lot of discussion around the food distribution infrastructure in our state. That many of those who provide services to those who are food insecure are over 60 and more vulnerable to the coronavirus. Is that the case with your organization?
I could go ahead and push in here. So I'm relatively young. I'm 22. So we have a larger number of young people, right? And since we're right next to the university, we're getting a lot of volunteers who are college students. That kind of brings its own precaution a little bit, right? Since college students right now are a population of people that have COVID and are spreading COVID. So we've got to be pretty careful and socially distance and insist on mask wearing and the whole 9 yards of safety precautions. But we do have younger folks, but just from the groups I work with in town that are also doing this work, it is a lot of older folks, and it scares me a lot for them. And I worry, and so I try to push in where I can and get volunteers for them where I can. But it's a really scary thing that so many of the people doing this important work are older. And not only just from COVID, but sometimes doing this bulk lifting that's happening right now where we're getting emergency food boxes or something like that. Those are 35 pounds, right? And continually moving these big boxes. I worry about my own mom when she's out there. So I definitely think it's something we need to think about and try to figure out ways that we can get some younger people involved to help these organizations keep doing the great work they're doing.
Thank you, Rourke.
Yeah, Kelly, I think too, I would just echo, what Rourke had said. And in addition, yeah, we do have a lot of seniors who help us on a volunteer level in all of our sites. So it was a huge challenge, and still continues to be a challenge. I think the way that we try to handle it is that we are working really hard to make sure that we're cross-training staff, so that we have, a couple different avenues for coverage, and so that, everyone gets, I don't want to sound dramatic. It's not as though we're like the fire department, but during COVID, you almost feel that way being a social service provider, especially if you're providing food and basic needs. So I know like my fellow panelists probably understand what I'm saying, but like we have staff who will work 10 hours straight, especially at the beginning of COVID, because we only have one cook, at the neighborhood centers. So we would do everything we could to keep that one cook healthy, that sort of thing. And then, yes, we did lose volunteers because we were encouraging people to stay home, but sort of balancing that with an all hands on deck approach. So like myself, my boss, a lot of us in the administrative, administrative parts of our agency just chipped in. So, we would don the PPE and just go in and fill in as needed. But it has been a little bit of a struggle.
I think in our case, especially with the meals that we're doing out of the canteen and the food box distributions that we're doing in outlying areas that they struggle to get to us, we've kind of, partnered with the other groups like United Way and Cabin Creek Health Systems. And so their employees and their AmeriCorps and Vistas and all those type of folks are coming in, and they're helping us get the job done. And we're all wearing the correct, PPE and doing what we can to try to work together to, keep our elderly population. Like my mom does the same thing. She does stuff for me here at the pantry. And so, trying to keep her safe. And a lot of times if we have older volunteers, I just have them doing things where they're not with the public. I leave that for me or some of the other folks and the employees, but the volunteers, I try to, in-house, keep them behind the desk here or there, or do things that they're not engaging so much with the general public all the time.
Thank you, panelists. Let's move to the next question. Have you seen an increase in volunteering since the pandemic began?
I definitely have. Folks who wanted to come in and help. A lot of them are, I think, getting stir crazy at home and they want to do something good. So we try to keep it as safe as possible. But we've had a lot of folks come in and help us pack boxes, hand out boxes, doing things that our short amount of staff can't accomplish in a small amount of time.
So we have not really seen an increase in volunteering. I think we've definitely seen an increase in people being willing to donate, which has been phenomenally helpful. So if people are donating monetarily, then we're able to make sure we have enough PPE. We're also able to make sure that we can serve everybody regardless of income. Because sort of to Vandy's point, like we have several different funding streams for our food security programs too. So, and during COVID, a lot of our funders sort of just said, throw those things out the window. We're serving anybody who needs the help, of course. So we had that little bit of a cushion donation-wise to be able to help any family and to really try to treat them holistically so that if they had, a utility that was due or, cost of prescription medications, or anything like that, we could sort of help to fill in the gaps with that extra donated funds.
Thank you, Sarah.
Mm-hmm.
Work, have you seen an increase in volunteering?
Yeah, I certainly think so. But part of that, I think, is when students come back too, we get a whole influx of young people. So there are some kind of cyclical patterns that go in Morgantown a little bit with volunteers, right? Like at the end of the year, we'll see all the students trying to graduate who have hours that they need to complete. So we kind of get chunks like that here and there, but we have seen an increase in other groups just trying to get involved. One of the ones that's really great is when the National Guard comes. It makes it so easy when they're all out there working for us. So we've been really thankful for groups like that. And we've seen a lot of that from businesses, from teams that aren't playing right now that are trying to do something good in their community. So we've definitely seen an increase.
Thank you. As a state, what do you think we should do to improve the way we help those who are food insecure, and how could we go about it? Nice, easy question. Anyone want to take it on?
I can start maybe. So I think that we should expand SNAP benefits. I know in recent years we've kind of taken steps backwards in that, trying to put work requirements, things like that. But every dollar of SNAP money that comes into West Virginia generates $1.8. And so it's kind of just a crazy proposition that we'd be against a program that feeds people, that helps people. And so I think the expansion of SNAP would be like the single greatest way to really make an impact that's sustainable and would continue on. So, yeah.
I would wholeheartedly agree with that. I mean, as I said earlier, sometimes when you ask a senior citizen what they get in SNAP benefits and they say $16, well, what good is $16 in a month's time? That buys you a couple basics that'll last you maybe a week. And it does generate income and jobs for our economy. So, you know, there's more jobs to offer. More folks are hopefully, you know, getting work. But so many people, food is expensive. And so many people just can't make it off what little bit they get off the food stamps. I'm not sure what they judge it on. I know there's income levels, but if it's anything like the financial assistance, then their income levels haven't changed in a really long time to reflect what's going on today versus, you know, 30 years ago.
Okay, I'll move on to the Q&A from the chat box. So Anna asks a question. I believe this is for you, Sarah. Do you know why suicide rates are higher in the older West Virginia population, and what causes them to commit suicide?
Great question. I wish that we knew more about that. I think that the health summit that I had gone to, the conference where they presented all of that, tons of public health information, they didn't necessarily offer because they weren't drilling down into the root cause of every single stat they were presenting. But I would imagine, just anecdotally, a lot of the other, you know, social determinants of health and some of the environmental barriers of living rurally, I think that cannot be underestimated. It's just a huge issue for people to be living on their own. I mean, one of the other stats that they shared at that conference was that seniors in West Virginia, many more of them own their own home and many more of them live alone. And at earlier ages, they live alone. So I just think that isolation is a big thing. And I think all social service providers will tell you, you know, just that social support of having someone to talk to, someone to lean on, someone who's trusted that they can call and say, hey, I'm really having a bad week. You know, can I come get an extra food box? Those are the kind of relationships that need to be established so that people don't feel so alone. I mean, that's what I don't know if Rourke or Vandy have anything to add to that, but I would think that that's why some seniors end up feeling just so hopeless.
I would totally agree with that. Isolation is definitely a big thing. And I mean, you get a lot of them who just call, and like our seniors that we, you know, call, you know, to let them know either we're delivering their box or their box needs picked up or whatever the case. Sometimes just getting them off the phone, and they have, you know, they want to chat and tell you all kinds of different things. And, but I mean, health causes, the rising cost, they're small Social Security checks can't manage, especially if their home is older and needs repair or just wear and tear, or, you know, their cost of living, they can't maintain it. And that's got to be hard on a person, especially a person who's proud and has always been able to, you know, take care of themselves or their families. And you have a lot of seniors now that are getting grandkids, even great-grandparents who are raising grandkids, which is a huge challenge, and their older adult children are coming back, and so many of them get taken advantage of. I know that's got to be hard on them mentally, physically, and financially. So I think all those things factor into that struggle and that, you know, potential suicide rate.
Thanks, Vandy. Okay, so a question from the Q&A box from Judith. Well, I think it's a comment. Many pantries have senior volunteers because of hours of service are daytime, making it difficult for younger volunteers because of work or school. Many pantries serve from 8 a.m. to 4 or 5 p.m. Thank you, Judith, for that comment. That's important to note. I didn't think about that. Next is Sharon Maynard, who says, excellent presentations. Thank you to all the panelists. Rourke, do students feel embarrassed in front of their peers to come into the school pantry? Is there a privacy opportunity for them to take advantage of your assistance?
Yeah, so definitely, I think that if it has to happen in front of someone, I do think that a lot of students feel embarrassed. So, and I probably didn't explain this very well, but the way that they're set up in the schools is in a kind of a private location in the school. So, depending on space in that school, it's a little bit different. Like at Westwood, it's in the concession stand for their basketball games. But at like Suncrest, they have their own like empty room for it. So kind of place to place, it's a little different, but they're all a private place that's open during the day that students don't have to ask anyone about, right? And we figured out different ways to do, to kind of accommodate people, right? So some of the schools do like some after hours times where like the principal and a counselor and maybe our school rep will be there. And parents can come in after school for like a 2-hour window to pick up stuff with their kids, right? Or they do it at walk and talk, or teachers find times to get kids there. So it's something we work with the schools to figure out the best way to make sure that kids are able to utilize it and access it, and that it fits with that school's kind of culture and the way that they do things. Also, if I could just add one point back on the kind of comment about the senior volunteers, that's something that I think about a lot in terms of the time pattern, right? So a lot of pantries, a lot of food assistance programs, they work on these kind of interesting like time intervals, right? So some of them are, it's every 2 weeks, right? And you've got to be here during this like 10 to 2 window. And that's really tough for some folks. And especially during virtual school and all this, a lot of times parents have to be home with their kid to help them do that stuff, right? Or maybe they're homeschooling right now. So there are a lot of other concerns right now where we've got to figure out ways to expand hours and to meet the need in the times that it's available, right? When people are working, whatever, we've got to work around that. So that's been something we're doing, is trying to do some later kind of afternoon hours along with everything we're doing.
Rourke, I have 2 follow-up questions for you. First off, is there like a centralized map of the state of which schools have pantries?
So we're essentially only in Mon County. We have a pilot program in Preston County, and then like a pilot program in Annapolis, Maryland. But we're not across the whole state or anything like that.
Right. So has anyone ever like contacted you and asked you for your information to try and compile a statewide assessment? Because I'm just wondering how many schools do have pantries around this.
Do the food banks have that information? Because a lot of them have like backpack programs and those kind of things. Would they have like a listing of the schools in the state that they provide to, or that the schools get product from them?
Some of them might. I think the best place to kind of find a whole list of that information might be like the Food Justice Lab, their like map of food providers across the state. So I think you can find most of the programs that are doing stuff. I don't know if there's any real way to kind of break it down to like, these are just school programs.
Yeah. My second question is, has anyone ever kind of contacted you to try and amass those who do work in the schools to collaborate on like best practices to address things like how do you discuss stigma and has that happened?
I don't know. No, it has not. I honestly, sometimes it's hard to even share stuff like that with like the organizations that are around you. So no, there's not been like a whole big thing about it. It's one thing I'll say about this work that has been a little bit interesting to me, or something I didn't expect, is that it can be a little territorial at times, and folks get like really geared up about that. And so to me, it's just like, as long as people are getting fed and getting the stuff they need, who cares who's doing it? whatever. But kind of the sharing stuff has not been as easy as I maybe would have wanted it. So.
Thanks.
Well, don't stop trying.
Definitely.
Sorry, my older wisdom is saying, Rorik, no, don't stop talking about it, because a lot of the things you talked about, just sorry to interrupt, Kelly, but real briefly, when I put on my slide, like non-judgment always, I loved that you gave the example of, there may be a kid attending school, public school, that has a family that goes to every single food pantry that's available in that county. So to some, looking from the outside in, they can very much be like, oh, well, that person's just cheating the system. And that is not the way we should be looking at food insecurity. Not at all. We should really be trying to understand, first of all, I would give kudos to that parent for being resourceful. If they qualify for 4 different food pantries, then that they're really doing the planning for meals, and they're helping to make sure that they don't have an empty refrigerator for their children at any given point in the month. So, it does involve some of that education. I think someone like Rorik, or your agency would be great for educating even just the general public about what food insecurity really looks like in reality.
Thank you.
Sure.
Sarah. So our next question is from Tad. Through the sessions thus far, a lot of the panelists have mentioned a gap in SNAP benefits, i.e. the benefits are not at a level to provide enough food for the person or the household. Do we have a sense of why that is? Is it that there is a delay in benefits? Are there more people living in households than qualify for benefits? Is it an unwillingness to apply for benefits? All of the above, or something else? Looking for potential policy change advocacy points.
I think to Rorik's earlier point, and Vandy had agreed, it's mostly the issue is that there's not enough federal money coming down to adequately, address the need. So I think that is something that I too full-heartedly agree with, is just continuing to advocate for more and more SNAP expansion. It makes sense in terms of, even budgetary. It makes sense for the community to pour more money into SNAP so that people aren't hungry, and then also, it generates, local business and all those other good things that follow. But I think that's one thing. I mean, we can only do what we can do as service providers with the amount of SNAP benefit that a person or a family receives. And it's not a lot. It's really not a lot.
There's only a handful of households that receive a significant amount that could actually get them through an entire month if they did it right. But you have a lot of generations of families living together, households with brothers and sisters and moms and dads, like adult brothers and sisters, moms, generations living together right now. Not everyone in that generation qualifies for food stamps. There's a stigma still, I think, even with in our administration and our government, that people who want food stamps are bums or lazy. And I mean, I know plenty of working people who, once you pay bills, there's not a lot of money left, but that you don't qualify for food stamps because you make too much. So, giving that boost to those who are doing okay, but still struggling. Or you have so many folks that if they're not working 20 hours a week, they get bumped off after 3 months because they don't meet the work qualification. Well, right now, good luck finding a job sometimes that lets you work 20 hours a week. It's not that they don't want to, it's the available hours aren't there. So there's a lot of challenges on a policy level, income guidelines in themselves that really probably need to be looked at to kind of avoid some of those gaps. So in West Virginia in 2019, the average SNAP benefit per person per meal was $1.19. That's not very much, right? It's $117 a month. It's tough. I've actually tried to live a week off what would essentially be my SNAP benefits. And it was tough. I was hungry every day. I was really irritable and angry. And it's if you make the smallest mistake, right, that you're price counting stuff and you're at the grocery store, and then you go up there and you don't have enough money, it sucks your soul out. It ruins your day. And I can't imagine having to live like that, right? And that's my own privilege speaking, where I've never had to be hungry. I've never
never worried about that stuff. But it really, I don't think you can really understand unless you really try to put yourself in somebody's shoes, that you're at the grocery store and you've got only this money to spend to feed your family, right? And it's such a small amount, right? And what happens if there's a birthday? Do you get a birthday cake, right? What happens when it's Halloween? Do you get candy? Do you get Halloween costumes, right? All that stuff is not built into a SNAP benefit, right? We're not accounting for all those other things, right? That regular families are paying for, that are just buying for their kids. So that's something that I think $1.19, like, that's not enough.
But I think too, factoring in that most of our folks, especially if they live in a more rural area or not close to major chain grocery stores and Walmarts, you pay for a gallon of milk at Walmart might be $2 and something. You pay for a gallon of milk at a gas station and you're looking at $4 and something. So when you're having to go to the closest place because that's all you can get a ride to, that's what's walkable, that's what's on a bus route, you're dwindling away your SNAP allotment a lot faster because you're having to pay higher prices because of the locale. So that's definitely something to take into a factor. A lot of people have to go to those places. And then if they go to dollar stores and Family Dollars, is the stuff they're getting nutritious, or is it just processed junk that they charge $1 for and they can make it last, but it's not really filling and it doesn't meet their nutritional needs?
That's a really important point. Thank you, Vandy.
Mm-hmm.
We have one more comment in the chat box and then one more in the Q&A box. So Anna says, to work. Some clinics in my area do a pharmacy program. They have the fresh fruit and vegetables at the clinic so patients can get it while they are there. I believe this was a grant through Catholic Charities in Parkersburg area. I believe this is done in summer months in conjunction with farmers markets. Thank you, Anna. And I know that a number like Cabin Creek in Charleston and some other FQHCs have partnered for the pharmacy program. And I think that's something that we'll try to look into to share more information about in future months. And then Judith says, seniors with meds that require more of their Social Security dollars and they get $16 in SNAP, they must make the choice to eat or pay for medications, rent, utilities, hygiene products, etc. Thus, more SNAP is needed for many seniors. That's an important point. Thank you, Judith. And that's a good segue into wrapping it up, because next Tuesday will be our final session and we will be talking specifically on policy. So we will have a lot of discussion around SNAP and what we can do on a federal and state level to ensure that people have access to nutritious food. And so we hope you'll join us next Tuesday at 10 a.m. And bring your questions. If you have any questions that you would like to ask beforehand, please feel free to shoot that to me. So does anyone have any final thoughts they'd like to share? So thank you so much to Unicare and Tad Haynes for sponsoring this important series. Thanks to our panelists. You all were really wonderful and insightful and obviously very busy people. So we thank you for your time. Thanks to the attendees who have joined us, and I hope to see you all next week. Bye, everyone.
Bye.